Thank you very much, Mr. Chairman. And let me first say, here we go again, just 1 week after the one-year anniversary of this Affordable Health Care Act. The subcommittee is holding yet another hearing attempting to undermine it, and what the true costs that we should be talking about today are what would have happened if we had not taken action. The Affordable Care Act makes health care affordable for the middle class and has halted the steady rise in health costs that led us to much of our budgetary woes over the years. For all the talk of the sky falling, my majority colleagues have repeatedly failed to provide any alternative ideas that would come remotely close to accomplishing what the Affordable Care Act does. They had 6 years of control of the House, Senate, and White House and provided no leadership on this issue. All we have are alarmist sound bites and false platitudes, and even more frightening are the true costs that will come if the new majority places spending caps or block grants Medicaid as they propose to do. These actions will not save money. It will simply abdicate responsibility and shift costs to state providers and beneficiaries. Now, let me say that Secretary Sebelius and Assistant Secretary Greenlee disagree with some of my Republican colleagues who have been saying that there is double counting in letters they have sent to ranking members Waxman and Pallone. This is Secretary Sebelius and Assistant Secretary Greenlee have sent letters to Mr. Waxman and Mr. Pallone saying that there is not double counting. And the Secretary gives this example, and I quote from her, quote, "In the same way, when a baseball player hits a homer, it both adds 1 run to his team's score and also improves his batting average. Neither situation involves double counting." So I would like to submit these letters for the record.
Without objection, so ordered.
Thank you, Mr. Chairman. Now, it's interesting that my colleagues on the other side of the aisle, talk about how much cost the Affordable Care Act is going to cost. I'd like to remind them that when Republicans passed the Medicare Modernization Act in 2003, they did not offset its costs. CBO estimated the bill would add $394 billion to the deficit over 10 years. And CBO is our official scorekeeper. So let me ask Mr. Elmendorf, how much will the prescription drug benefit draw from general revenues over 75 years, which is the traditional long-term horizon used for actuarial projections in the Medicare Trustees Report?
So I'm sorry, Congressman, I don't have the answer to that question offhand. Maybe Rick does, based on their own estimates of the Office of the Actuary.
Yeah. Mr. Forster?
One moment. The present value of the general revenues for Part D over the 75-year period are estimated to be about $7.2 trillion.
Thank you. $7.2 trillion. Based, as you said, on the most recent trustees report, the unfunded obligation is $7.2 trillion. Did the Medicare Modernization Act include other provisions increasing revenues or cutting spending that might come close to generating the resources to meet this $7.2 trillion obligation from general revenues?
No, it was clearly a new expenditure for a new program.
Yes, so the answer is no. I agree with that. CBO's net score for the Medicare Modernization Act was $394 billion, which included nearly $410 billion in new spending for the prescription drug benefit and only about $16 billion in offsetting savings over 10 years. This means the vast majority of the prescription drug benefits cost, $394 billion, over the first 10 years was added to the deficit. So my Republican friends seem to be saying, do as I say, not as I do. And I think one of my colleagues, I think it was one of my colleagues before, had mentioned how the tax breaks for the rich and the estate tax breaks and everything else just keeps adding trillions and trillions and trillions of dollars to the deficit. And when my friends on the other side of the aisle were in control for 6 years, passing Medicare Part D, they didn't seem to care about the deficit then. But I guess, whenever you have the newfound religion, it's great. but I think we also need to be consistent. Thank you, Mr. Chairman. I yield back.